All right, we are live. Hello, everyone. Welcome to the Love Life Telehealth webinar today. I'm Dr. Niki Davis, and I am joined by Dr. Jeffrey Pierce. And today is especially exciting because we are talking about a topic that maybe doesn't sound all that exciting, but it actually is pretty interesting. I think it's one of those things that is affecting a lot of people, and maybe they're not even aware of it. So we are going to be talking about fatty liver disease today. So Jeff, why don't you just give us a little brief synopsis of who you are?
Sure. Nice to be on a talk with you today, Dr. Davis. I am a family doc by training, born and raised in Texas. So if y'all slips out, you'll catch that. I then later went on and got additional training in lifestyle medicine, just like Niki here, and we have training in getting to the root cause of so many of the chronic illnesses that are plaguing us, our loved ones. We focus on things like what's the right thing to eat and the right way to move and the right way to de-stress to treat and reverse things like diabetes and high cholesterol, heart disease, etc. And I live and work in Northern California, an hour north of San Francisco. Spring is springing over here. It's a beautiful day. And I'm happy to be joining and talking about an important topic with you today.
Yeah, thank you. And I think that the thing that kind of got us excited about talking about this was, now you wrote an article about fatty liver disease in the National Health Association publication.
Yeah, I did.
Called Health Science Magazine.
I have it right here.
Look at that. Oh, it's beautiful.
They do such a great job. So the National Health Association has been around for a long time, and they make a really good print, advertisement-free journal that comes out like 4 times a year, 3-4 times a year. And this article came out spring of last year, talking about a lifestyle medicine approach to fatty liver disease. And I love working with them. You should check them out, become a member. It's really affordable. It's something like, what is it, like $40-45 a year. And you get a great access to their mag, and they have a wonderful conference as well.
Awesome. Well, perfect. Well, and I just want to also introduce another guest that we have today, hiding. Here she is. This is Penelope. She's going to be hanging out with us. I was hoping she would take a little nap on my lap, but she wants to be up and at it and part of this. So she might kind of peek in. So if you see a little fur ball kind of peeking her head in, it's Penelope, my new puppy.
Penelope, the true star of Love Life Telehealth's
yes.
social media channels. Yes. Up and coming rising star.
Understandably so, right? She's got all that charisma. Yeah. All right. Well, let's get to it. So fatty liver disease. Dr. Pierce, why don't you start by just, I think a lot of people have probably heard of it, but maybe don't really understand. So maybe discussing what it is, kind of the definitions, because there are a lot of different terms that are used to describe it. And actually there are different reasons for why people might get fatty liver disease. So maybe just kind of start with that, if you don't mind.
For sure. So we're talking about the liver today, a big organ that sits mostly under our ribs on the right side. Penelope, please, if you don't mind, right there. Assuming that our comparative anatomy is, about the same. I think it's on their right side too. And the liver is amazing, right? It does so many things for us. We depend on it every day, though most of us don't think about it, right? It's there making antibodies and hormones and filtering something like 6 cups a minute of our blood. All of our blood goes through the liver, and it's also important for making bile, which is that liquid that is made in the liver, stored in the gallbladder, and helps us to break down the fats in our diet. It's important for our immune system. I mean, it's just super important, and it is a pretty tough organ as well. It can regenerate better than just about any organ in the body, and we would not live without it. And we only have
That's
one.
true.
We only have one, right?
Yeah,
We like
that's
I'm going to
true.
donate my right liver to my brother because he's sick, and I'll have my left liver there. I mean, there's just one, and so we got to take care of it. And it turns out that by and large, our livers are suffering around the world now without most people knowing about it. And that is due to this condition that we're talking about today. So it's for short, we call it fatty liver disease. But if we want to get specific, it is metabolic dysfunction associated steatohepatitis and steatotic liver disease. A couple of different
That's a
phrases.
mouthful. That is a
Yeah, and so
mouthful. I
it
kind of
turns
feel
out
like
the
fatty
fatty
liver
liver
is a lot easier.
just kind of rolls off the tongue a little bit easier. MASLD would be the abbreviation. Also doesn't really do well. So for metabolic dysfunction associated steatotic liver disease, let's just say fatty liver today. And basically, it's a spectrum of conditions. Um, on one hand, the very mildest form, there's maybe a little bit too much fatty deposits in our liver. And then as we progress, there's more fatty liver, more fatty deposits in our liver with associated inflammation. So just like when you stub your toe or you get a mosquito bite, there's inflammation there, and that's a sign of the body reacting to something that shouldn't be going on. There is inflammation in the liver. And then as we progress further and further on, there's some fibrosis, which is basically some scarring, until we get to what's called cirrhosis, which is sort of end-stage liver scarring, where the liver isn't functioning and it can completely stop functioning, and we can go into a coma, we can die. We might need a liver transplant if we're lucky enough to get one. And so it's a spectrum of conditions. But that's all of that is what we're talking about when we talk about fatty liver disease. So that's a little bit about the definitions.
Yeah,
Um,
so the metabolic dysfunction is really not due to alcohol, because we also have, fatty liver disease that is due to drinking excess alcohol. And so for a long time, at least as medical professionals, we used to call the metabolic dysfunction non-alcoholic fatty liver disease, right?
mhm.
But now we're recognizing that it is a metabolic dysfunction, and that, as we take in excess calories, excess fat, that can get deposited into your organs, such as your liver.
It's true. Back when I was in training, this goes back a bit, but in when I was an intern in 2004, when we would see this, we'd say, "Oh, their liver enzymes are abnormal." Um, Good news, it's not hepatitis C, it's not alcoholic liver disease. Um, uh, it's not that bad. But we didn't realize the enormity of the issue at the time. And while heavy alcohol use can damage the liver and cause a type of fatty liver disease, it is now way outnumbered by the cases of fatty liver disease due to basically what we're eating, what we're not eating, our sedentary lifestyle, and if we're carrying extra weight, etc. And we'll go into all that. But basically, this is has been called the next epidemic, global epidemic. It is now the most common cause of liver disease in adults, and it's also the most common cause of liver damage in kids. I mean, I have a friend who is a pediatric gastroenterologist, so he specializes in kids with different digestive system issues, and he sees kids with this every day. And
Wow.
it is that alone should maybe be the biggest wake up call of anything that we're discussing today.
Absolutely. And that was something that, as I was going through and reading your article, I was shocked by. I don't know why, because we also know that atherosclerosis, or plaque buildup, hardening of the arteries, is something that we're seeing we're seeing those fatty streaks in children. So it is something that we're seeing. I mean, we're seeing chronic diseases starting earlier and earlier.
Yeah.
So it's really sad.
Yep. Yep. And it's a time to really spread the word about this, and to talk a little bit about, hey, what are the causes? What are we doing? And then what can we do about it?
Yeah.
Knowledge is power.
So yeah. So I guess if you could tell us a little bit about, what are the causes? What do we think is causing this fatty liver disease that is due to a metabolic dysfunction?
Yeah. Did Penelope have another question as well there, or
She
no?
might. Yeah.
Yeah. Okay.
She's feisty right now.
Yeah. Yeah. So knowing the causes is important, right? Because then we can say, okay, so if this is what's causing it, what can we do to prevent and treat it? And so while the scientists in the lab don't have everything figured out yet, we know that there's a strong association with a couple things. One is probably the biggest ones are excess calorie intake, and particularly calories coming from saturated fat and processed carbs. And I know you and I recently had a fun time having a discussion over ultra processed foods, and this ties in definitely with that. When you look at what the average American is eating day in and day out, it is foods that have been processed, where a lot of the good things are taken out, a lot of unhealthy things are put in to make them palatable, and then also a lot of cheap, sort of saturated fat-ridden animal products that have made it into our sort of fast food and processed culture. And so a big part is the calories that we're consuming. Highly also, speaking of the ultra processed foods, highly associated with soda intake. Studies show, like when you look at the graph, as soda intake increases, your risk of fatty liver disease increases. So things like high fructose corn syrup plays a role. Our level of activity plays a big role, whether or not we're sedentary or we're active. Basically, so many of these conditions that lead to what is our old nemesis that we talk about all the time, which is insulin resistance. And this is this abnormal state that our body gets into when we have excess calorie intake, unhealthy calorie particularly, lead a sedentary lifestyle, are carrying excess weight, and our liver doesn't work as well as it should. Our pancreas doesn't work as well as it should. Our skeletal muscles are not taking up the glucose, our blood glucose, in a healthy way. And it's this cascade of events that leads to all these associated conditions that are related: type 2 diabetes, obesity, high blood pressure, the metabolic syndrome with high triglycerides and high elevated blood pressure. All these things are related. So that's why when you see someone who has a diagnosis of one, we're always looking for the other associated conditions, because they usually travel together.
Right. Yeah. So, it's interesting. I can understand how when you're taking in a lot of excess fat in your diet, a lot of saturated fat, that does translate to extra fat in your body, and your body is looking for places to store it when it runs out of room, say in your muscle cells, and so it will store it in your liver. As far as the soda goes, is that, do you think that is because, when you're drinking excess soda, you're drinking excess calories, that at some point your body needs to deal with those excess calories, and then it converts it into fat and deposits it in the liver?
It's a good question, and I don't know the answer to that. I think that's very likely a part of it, though it just seems that there is also a strong association with processed fructose, with like the high fructose
Yeah.
corn syrup, and I wonder if there's almost certainly multiple things going on, multiple pathways that are involved.
Yeah. So it's really the processed, like you mentioned, the ultra processed foods.
Yeah,
Yeah.
yeah,
Yeah.
it's such a big player.
Yeah, that makes sense. Okay, so what do we do to get that out of our diets?
Yeah, it's a
Saturated fat,
yeah,
the processed
saturated
foods.
fat, processed foods, the cholesterol and the oxidized cholesterol, which of course are not present in plant foods. So, let's see. I just wanted to make sure that I touched on. Um, there's one point that I wanted to mention before we go into like ways to help avoid it is
Yeah,
um, one thing that was pretty shocking as I was doing my research was the how quickly this can develop, it goes along with why we see it in kids, for example, that you don't have to be 70 years old to have build up enough injuries and damages to your system to develop this. It's something that can develop fairly quickly. And there was that kind of movie that left many of us kind of queasy when we were watching it, but Super Size Me with Morgan Spurlock, which is a great movie if you haven't seen it, and the folks in the audience, where he decided to get all of his nutrition. I don't know if I should even use that word, but all of his calories from McDonald's for a month. And then he watched what happened to how his blood pressure went up, his weight went up, his cholesterol went up, and during that month, he had liver damage from the foods that he was eating. And that's like
so his
amazing.
liver enzymes were elevated.
Enzymes went up on blood
Yeah,
test, and how amazing that was that happened just in a month. But a Swedish study that was done sort of mimicking that approach put healthy subjects on basically two fast food meals a day and told them to be less active. And they saw liver changes in the blood in a week, which
wow.
doesn't mean that they had, fibrosis and needed a liver transplant in a week, but it certainly showed the beginning of the body's response to these injuries that happen in such a short amount of time. So
Yeah,
um, when you see something like that, it's a bit scary on how fast it can happen, but it's also makes me in a way more positive by how quickly things should be able to turn around when we start doing the right things.
absolutely. And I will say that that has been what I have seen in my practice in people who come to me and are more on a standard American diet and wanting to transition to a more plant-based or plant-forward diet, that if they have been diagnosed with fatty liver disease, which, by the way, that I think you had mentioned this in your article, that really the only way to really diagnose this is a biopsy, like to get a really true
Yeah,
diagnosis.
right.
Yeah, but we know that if your liver enzymes are elevated and you don't have maybe the risks of the other things that can cause fatty liver disease, and if you get an ultrasound that shows maybe some fat deposits in your liver, it's most likely that that's what's going on.
Right.
But I'll have people come to me who are diagnosed with it, and very quickly their liver enzymes resolve
Yeah.
once they start making the changes. And also interestingly, so now you're in Santa Rosa, California, which I'm so jealous because you get to be really close to True North Health Center, which is a fasting center there. They serve lots of delicious plant-based foods. But and I don't know if they're still doing it, but I know for a time they were doing a study where they were doing scans, like a DEXA type scan of people as they were coming in to the center and then as they were leaving. And basically what they were looking at, with a DEXA scan, a lot of people might have heard of that because, we're looking at the density of bones, but you can also look at fat in the body using that kind of a scan. And that's exactly what they were doing. They were saying, okay, where is the fat accumulation in the body? And where does the body preferentially start um, mobilizing that fat? Where does it start to take that fat and get rid of it as you're losing weight?
Right.
Whether it's through the fasting program or just eating a plant-based diet. And they did find that you're, at least in True North, I don't know if this has been replicated or not, but at True North, at least, they found that uh, it very quickly was coming from the visceral fat, the fat in the organs. That's where the body, I think, realizes that that's the most dangerous place to store fat, and so it probably, is something that is beneficial for health to get rid of that fat first, instead of just the fat that's under the skin or things like that.
Isn't that amazing how we start putting on, typically we start putting on excess calories as fat in, externally or just under the skin, in the belly and the hips and the butt and whatnot, to which could, when a famine comes and when it's cold, it can help us in those situations. And then as the process gets further and further along, then it starts sort of depositing where it's unhealthy to be deposited in our muscles and in our internal organs, in and around our internal organs. But then it's sort of, when there's like, it's running out of places to put it, as you said earlier, and then the first to come off. And I've heard that as well. And the body is just such an incredible system that it has developed over the millennia to be that smart, to be able to do that unconsciously, to get rid of the most dangerous fat first. And that's awesome. Some people are like, oh, but I still have a little bit of belly and I've been doing this, lifestyle for 6 months. I'm like, yeah, but think of how the stuff that's going on underneath the covers here that you don't see underneath the hood, all the really important stuff that's happening.
Absolutely. Because, getting rid of that visceral fat, which is interior, is so much more important than, worrying about a little bit of fat that might be just under the skin. That's not going to be causing as much of an issue as the fat that is in our organs, and causing our organs to not function the way they are. I mean, you talked earlier about the liver and how important it is, and it's 6 cups of blood every minute. I mean, that is pretty incredible. And if you don't allow your liver to do its job and get that process done, that is where you start to have those issues. Whereas having a little extra fat under the skin, it's something that you may not like the look of, but it's not nearly as dangerous as having excess fat in your organs.
True.
Yeah. All right. Let's see. So we've talked about how, when you have fatty liver, it's something that can progress over time. You can get to where your liver, instead of just having the fatty deposits, can become inflamed. And if you leave it like that and it continues to take on extra fat, continues to be inflamed for a long period of time, your liver enzymes are elevated, then it can lead to scarring and what we call cirrhosis of the liver, which is not reversible. And so it is something that you want to make sure. Now, you did say something in your article too, that we don't really screen for it. I guess unless you're, if you're getting as an annual lab test, you're getting a comprehensive metabolic panel that includes AST and ALT, which are, the most common liver enzymes that we're looking at. Then if you see that those are elevated, then you might, as a practitioner, might look and find out, okay, why is that going on? But there isn't, besides that, there's not really a screening. There isn't like, go in and get your ultrasound and make sure you don't have fatty liver disease.
Right. Yeah. There are all sorts of medical organizations that we follow for their recommendations that physicians should be doing every year, right? The United States Preventive Services Task Force, which says, okay, every man of this age should be screened for this. Every woman of this age should be screened for that. And they don't say that, okay, everyone between the ages of this and this should go in and get their fatty liver test. I'm not entirely sure why. Part of it is such that, well, there's not a perfect test for it. We're not going to recommend everybody to go in to get this invasive liver biopsy. Screening tests should be non-invasive or minimally invasive. They should have pick up close to everybody with the disease. They shouldn't be too expensive, blah, blah, blah. There's a whole bunch of categories for what makes a good screening test. And they should be hopefully pretty specific. So the problem with the sort of generic liver enzymes that we were just talking about is that they might be bumped because we, had a bender this weekend for New Year's, or that we took too much Tylenol, or that we had, or that we have undiagnosed hepatitis C. You know, there's a whole bunch of reasons why those liver tests can be up. And there's also a whole bunch of people with fatty liver disease who don't have a change in their liver enzymes. That's challenging.
Right.
In the ultrasound, you know, early on in the disease, the ultrasound might be normal, and then later on in the disease, it might be abnormal, but it could be abnormal due to the alcohol, et cetera. So there's just not a perfect way to screen for it. But like you said, we do our best based on this combination of things. The pediatricians, I think, do a better job than the adult docs, who say that, yes, kids with obesity or overweight and some risk factors like having diabetes and stuff, they should be screened for fatty liver disease. And maybe that's because I don't know why they do a better job than the adult docs, but that is an official recommendation among kids. And so if you get this diagnosis or this probable diagnosis, then you are ruling out other things. You're making sure that there are not other conditions that are causing it. And you're also looking for the other conditions that are associated with it. Like, okay, ma'am, you have fatty liver disease. Let's make sure you don't have type 2 diabetes. Let's make sure you don't have hypertension. Let's make sure you don't have high cholesterol, etc. And then with that information, it's not, well, sorry, good luck. And it's also not, here, take this pill, you're going to be better in a week. It's really a 4-pronged approach that I think is the best way to address this. We can talk about that now, if that's all right.
Yeah, definitely, because it is a bit unique in a way that there isn't a medication that if you are diagnosed with it, your doctor is just going to say, all right, start taking this medication, right? We know about all the medications that are typically given to people who get diagnosed with type 2 diabetes, with high blood pressure, with high cholesterol. But fatty liver disease is different in that it really is, I mean, and all of those things are lifestyle related, right? 100%. But there isn't a typical Band-Aid that's used for fatty liver disease. And really, it needs to be a lifestyle change.
Yeah,
so
right.
I would love to hear the 4 different areas that we need to look at for helping either prevent or reverse fatty liver.
For sure. And you know, with how prevalent this condition is, you know that the drug companies are working on something, and there are there are things like the GLP-1 drugs, liraglutide and semaglutide and stuff that can have some effect, and I'm sure they're looking closely at how to make that even more money for their company. But what can we do on a very basic level? So thinking about 4 things. So and you'll hear a couple of these at least from any doc, liver doc, internist, family doc, etc. And but then I think lifestyle medicine really hones in on it real well. So number 1 is weight loss. Most people with fatty liver disease are either are in the overweight or obese range. And we know that it's tough to have perfect tests for these things. BMI, which measures our ratio of height and weight, is not a perfect test. But most people, if you look at folks who are in the overweight range, I believe it was something like 75% of people have fatty liver disease. And if you are in the BMI of 40 or greater, about 90% of folks in that range have fatty liver disease. And so losing weight, even 3 to 5% of body weight, can start to improve things, and 7 to 10% of body weight, which is can be easy, can be challenging depending on the person, but that can bring about changes where you even had liver biopsy changes that showed inflammation and some early fibrosis, and that can even get better when you're in the 7 to 10% weight loss range. And so that's number 1 for most people, is weight loss.
Yeah. No matter how you do it, right? Which is probably why the GLP-1s are being looked at, because it is now becoming a weight loss drug.
For sure. Yeah. And we want, just like our friend Michael Greger likes to say, there are healthier ways and less healthy ways to lose weight. And while losing weight by most any means can help the fatty liver, we want to, in general, try to choose the healthiest ways to lose weight. Picking up a smoking habit or a cocaine habit to lose weight is not the healthiest weight loss method. And of course, and I say that not to be rude, but to say that there are some less healthy ways in some healthier ways. So tied into that weight loss is the second approach, which is eating a healthy plant-based diet, which I think helps in part because a healthy plant-based diet, this sort of whole food plant-based approach that we recommend, just naturally is lower in calories. So it leads to, you're satiated, you feel full, you're eating good food, but it's just lower in calories in a day-to-day basis. And over time, that leads to weight loss for the vast majority of people that is sustainable. But
Right.
it's,
That's the key.
yeah, sustainable. But what's so cool about the plant-based diet is that it works on fatty liver in multiple ways, right? It's not just the weight loss, right? It's that we are taking, in that sort of a diet, we've taken out a lot of the inflammatory foods, these ultra processed foods, some of the inflammatory animal foods that are either out or minimized. And that leads to less inflammation. And we are also filling our bodies with really anti-inflammatory foods, that your fruits and vegetables, etc., that will help to counteract any of the natural oxidation and inflammation that's going on in our liver. And it's full of fiber, this prebiotic fiber that our guts love to live on, the healthy microbiome lives on. And we certainly think that dysbiosis, or another way to say that is when there's too many bad intestinal bugs and not enough good intestinal bugs, that plays a role in fatty liver as well. And so you can see how multiple ways this whole food plant-based diet is addressing insulin resistance, addressing fatty liver at its core.
Right. And you mentioned, trying to combat that oxidation process. And I think a lot of people have heard of antioxidants, right? Let's eat our blueberries because they have antioxidants. Um, but to really understand that that really is, as you're ingesting something like that, it is helping to prevent that oxidation process, which is inflammatory in
Yeah.
the body. And you can see it very clearly when you are eating foods. You can cut a food that does not have a lot of antioxidants in it, like say a banana, and it's going to be going brown right away, or an avocado. Whereas foods that have antioxidants in them, especially high amounts, are not browning very quickly on the counter. So that's the oxidation process that you can actually see. And that's why it's so important to get those really pigmented foods into your body, to help with not only healing. If you're dealing with these chronic diseases, it's healing, but it's also prevention of the disease. You're really building up that great healthy system in your body that really needs those antioxidants.
Yeah, for sure. And I love how instead of taking a pill for fatty liver, which doesn't exist, but if it did, oftentimes in medicine, we're so hyper focused on something that pill helps with that one disease. Oh, by the way, it might hurt your body in other ways, and there's side effects and all this kind of stuff. But the one pill usually helps with one thing. But when you eat a diet that's rich in these super healthy foods, you are addressing all of these things that we've talked about today at the same time, while also eating really tasty food. So it's kind of a win-win-win.
Yeah, and going back to a whole food plant-based diet, also I want people to realize that this is not meant to be something that is okay, let's put you on a diet to help fix your
Yeah.
fatty liver. It is changing a lifestyle, and it is figuring out a way to make that something that you love, right? I think you and I both agree that we both eat plant-based exclusively, and we love the food. We love the taste of the food. And that is so important for making it sustainable, something that you can continue forever, that doesn't feel like you're just doing, the most popular diet and trying to stick to it for a few weeks, right? This is really meant to be something that you do forever. And just like you said, it can help reverse fatty liver in the early processes of it, and all of the other risk factors that are associated with fatty liver, like type 2 diabetes and high blood pressure and high cholesterol and obesity and all of those things. And what I have found helps with really making sure that the diet is sustainable and something that you love is making sure that you're getting not only a uh, diverse plant foods, but also making sure that you're getting enough starchy, complex carbohydrates in your diet. Because if I gave you a plate of just steamed broccoli and I said, there's your lunch, you might get full, but probably about 30 minutes, 45 minutes later, you're like, okay, what else is there? I need to eat something else. Like, it's just not satiating. Whereas if I
Yeah.
gave you a half a plate of steamed broccoli with some baked potatoes, boy, now that's filling, that's satiating. So you do need to have some of those starchy foods, whole grains, including rice, barley, potatoes, sweet potatoes, beans, corn, whole grains. So all of those foods are very filling, and you need to make sure that that is part of your diet, because it's not, I don't feel like it's sustainable to live on just salads, salads and fruit all day. I think you do need to have things that are going to fill you up and keep you happy, right? Mashed potatoes and gravy are delicious, and you can have that in a more healthy way without all the extra oils and animal products that are normally found in that.
Sure. Shout out to John McDougall and the Starch Solution, for sure.
Yeah, if you haven't read that book, it's my favorite.
That's great.
It's a great
Yeah.
book. Looks
Um,
like we have a question. Should we
all
answer the
righty.
question?
Sure.
All right. Bahez Ahmed says, hello, appreciate the show. If I can ask a question, can you please explain what the effects of fasting are on the liver? I am specifically asking about Ramadan type of fasting. So that's great. This is actually a really good segue, because you talked about kind of this 4-prong approach. We've talked about a couple of them, but I want to say that one of the others is based on some data that we have that supports fasting to help with fatty liver disease as well. Is that right?
Sure. Great question. Thank you for asking. Right before I answer that, I just 2 more points on the diet that I wanted to put in before I forget. There have been some studies on some herbs and spices. So ginger, turmeric, and Nigella sativa have been looked at in studies and may help because of perhaps their antioxidant effect, and also the omega-3s. So things like ground flax, chia, and hemp, or taking like an algae-based long chain omega-3. These may help also with fatty liver. Okay, so moving on to the third prong or the third approach is fasting. And I don't know, sir, if this has been looked at in specifically a Ramadan fasting lens. But what I can say is that there have been multiple studies that look at different ways of fasting, whether it's periodic fasting, like 1 day a week, alternate day fasting every other day, time restricted eating, which seems to be more in line with Ramadan. Some of these studies, where you eat for during an 8 or 12-hour window, and you fast for say a 16 or to 12-hour window, have shown that there are either improvements in liver enzymes or a decrease in liver fat content. The fasting studies often show an improvement in weight, an improvement in insulin sensitivity. And so from what I gathered when I was looking at this is that, it's not, we should only fast this way and not that way. But that probably multiple ways of fasting help our body say, wait a second, it's been a while since the last meal. Let's clean house a little bit. Let's get rid of unnecessary components in our cells, the autophagy that happens, and that there's a benefit. So I wouldn't be surprised if fasting associated with Ramadan was also helpful, but I can't say specifically.
Yeah, and I talk to my patients a lot about intermittent fasting, because I get asked that question a lot. And a lot of people, when they say intermittent fasting, I think typically mean time restricted eating, which is just, you're giving yourself a window of time to eat during the day, and then outside of that window, you don't. And really, to me, the big benefit of doing that is is giving your body a break from digesting food so that it can work on other things in the body, like DNA repair and clearing out toxins in the cells, and possibly mobilizing fat that's in dangerous locations, right? Why not start to do that if we can? But when you're digesting food, your body has no choice but to go and work on that process when it needs to. And so it's only when you've stopped eating and you've stopped digesting that food that your body has the ability to go in and start doing some of this repair work. So I usually will recommend to people who are interested in doing time restricted eating that really the benefit for me, in my opinion, would be just making sure that you're not eating too late at night, giving yourself 3 or 4 hours before you go to bed to take that break so that when you are sleeping, your body can do all the wonderful things that it's meant to do while you're sleeping and not be focused on digesting food. So eating breakfast, lunch, and dinner, but just having your dinner time be moved up a little bit. If you're used to eating at 8 o'clock at night, going to bed at 10, maybe you move that up to 6 p.m. But it doesn't mean, a lot of people I see will try to delay breakfast, or maybe they don't eat breakfast and they try to have a late lunch, and maybe they don't eat till noon or 1. I think that it's much healthier to actually eat breakfast and then just have your last meal of the day be earlier. And I know I'm familiar with one of the studies that was done on time restricted eating and how it can affect fatty liver disease. And I want to say it was maybe a 6 to 8 hour window was kind of that sweet spot for not only weight loss, but also improvement of fatty liver disease. I will say eating for 6 hours a day is not sustainable.
For most people,
I
I agree.
actually, yeah, once I heard of that study, I thought, well, if this is something I'm going to be recommending to people, any of my patients that have fatty liver as a possible treatment option, I want to know what it's like. And it was difficult because it's really difficult. I mean, you have to fit in 2 meals, and it's 6 hours it's not easy to fit 2 meals in, let alone there's no way you can fit in 3. So you're really just eating twice a day. And it's hard to get enough calories. It's hard to have enough energy to get through the day. So in my mind, if you have a period of time that you're going to try to restrict, to do that 6 to 8 hours, that might be something that maybe you can do temporarily to help really improve, the fatty liver disease quickly, but knowing that it's probably not something that's sustainable over time. Maybe 8 hours is more sustainable, or 10 or 12, but 6 certainly, in my opinion, is not sustainable for most people to do forever.
Yep. Yeah, I hear you on that. But part of the challenge, this is outside of the Ramadan setting, but just fasting in general, socially, it's tough when you're like, well, I got to stick to my 8 hour eating window, and the rest of the family, is coming home from work, coming home from school, and they're eating, and you're sitting there with your glass of water because you already had your 4 p.m. dinner, and it's just little. Yeah, so clearly eating is more than just nutrition and health. It's also the social connection and stuff like that. So yeah, it is challenging. But even, I think the first step for most folks is just 12 hours of not eating. So that avoids the late dessert and the middle of the night snack, and then the early morning Starbucks on the way to work. That is unfortunately how so many folks are stuck in that kind of habit. And it turns out that there's, some folks have a 6 hour window where only of where they're not eating. And that's just not enough time for the body to work on those other processes optimally.
Yeah, that makes a lot of sense.
Yep.
Yeah, so starting with a bigger window is basically the key, is saying, hey, if you can at least do 12 hours, which, that's 7 a.m. to 7 p.m. That's perfectly reasonable. Really starting there, because I think a lot of people don't really realize until you look at when you eat, if you start writing it down, that, boy, yeah, I did. I had something at 10:30 at night, and then I had my coffee with cream in it at 6 a.m. So I'm not getting that nice break, overnight.
Yeah. Well, I guess that takes us to the fourth approach. What do you think, Nikki?
Let's do it. I'm excited.
So the fourth approach is exercise, and exercise is potent in multiple ways, and it's not tied to the benefits from exercise aren't tied to weight loss necessarily. And so even folks who with fatty liver who start exercising and they have no change in their weight, we're showing benefits to their condition. And at least one study showed that doing multiple changes, so you're adding exercise, you're eating a healthier diet, work better than doing either alone. And just like we've been talking about these multiple benefits from a single change, of course, as we're exercising more, we're lowering our risk for heart attack and for stroke, high blood pressure. We're lowering our risk for cancers. We are feeling better. We're getting outside, hopefully in nature, and having that stress reduction there. And so, so exercise is that fourth approach in addition to the weight loss diet, fasting, and here we are at exercise.
All right, fantastic. And I don't know if there was anything else that you wanted to discuss regarding fatty liver. Any other final thoughts?
I mean, there are a couple of extra things. There's folks who are researching this might see that there's some potential benefit for high dose vitamin E, like 800 international units a day. It was shown in a study of people who didn't have diabetes but did have fatty liver to show an improvement. But the vitamin E thing's an interesting one because maybe there's also an increased risk of prostate cancer and sometimes some types of stroke and even death in some studies. And so I'm not usually telling people to take vitamin E. I'm not usually telling anybody to take vitamin E. Getting to the more extreme things like bariatric surgery, so the sort of major surgery to help with weight loss is very effective with helping to reverse fatty liver. But of course, if we could avoid the surgery and do it in a more natural way, it's probably beneficial. And so I would definitely recommend giving a good attempt working with a lifestyle medicine provider on all this kind of stuff before working with your surgeon on that. And then as that last sort of last ditch effort for folks who are too far down the line with their fatty liver disease, who have cirrhosis and have to be on a liver transplant, we know that there's more people who need a liver transplant than readily available livers. And it's not only that, but of course it's a highly complicated and risky procedure and needing to be on medications and all this kind of stuff. So anything that we can do to prevent that, because, if the trajectory doesn't change, they say that very soon, if not already, that fatty liver disease is going to be the major reason why folks need a liver transplant. And it's just something that we have created by this crazy lifestyle that has sort of seem normal to all of us. And it's so highly preventable and reversible. And so that's why we want to get the word out about this. We want people to talk to our docs about this and to not have to be looking at the decision of, surgery and liver transplants and all these kinds of things.
Yeah, and I like that, this is something that if you've been diagnosed with it, it doesn't have to be that, well, this is just what happens and you just have to live with it, and you should just eat better and go exercise, but not really be told what exactly that looks like and how to go about that. And that's where the lifestyle medicine doctors can really help to really walk you through that process and help you be successful. Because I think in a lot of things, people are looking for that magic pill, and maybe they're looking online, oh, vitamin E, that can help, right? All I have to do is take a pill. But that does not work. You really do have to put in the effort to improve the lifestyle so that you can reverse the disease that is due to the lifestyle, right? You need to change the lifestyle that created the problem in the first place and not look for the magic pill or the magic surgery, right? I mean, bariatric surgery is significant. And although I agree that there probably are people out there that really at some point that's one of their only opportunities, that's their only choice. For most people, once, most of us eat about the same amount of food every day, maybe 3-4 pounds of food. And if you can focus on foods that just naturally are more calorie dilute, like you were saying earlier, Dr. Pierce, it is something that once you get used to it and make it second nature for yourself, it isn't difficult to do. You just have to get over that initial hump of really uprooting your lifestyle and doing something different than what you're used to. But once you get it into place and you're just naturally eating these calorie dilute foods, the weight improves, the fatty liver disease improves, the blood pressure improves, the cholesterol improves, type 2 diabetes improves. All of those things improve once you find the right foods to eat. And that's really, in my opinion, where we get most of the benefit is what we're doing most of the time, which is eating. And we know that because when you go through, and for anyone who has done a fast, say for a day or 2 days, you realize very quickly, boy, I spent a lot of time eating. What am I going to do with myself when I'm not eating, right? That's a lot of what we do.
Yeah.
And that's where we get most of our exposure to our outside environment, is through our food, right? It's not through our skin. It's not through our lungs. It's through our gut. That's where we see so much of the environment go through our body. And so if you can really focus on those low fat, whole food, plant-based products, that's the secret sauce for improving all of these conditions.
Word. I agree.
Oh, well, it has been so much fun talking to you today, Dr. Pierce. Well done on the article. If people want to learn more and go back and find that article, go to the National Health Association magazine from, you said, the spring of 2024. There it is. There it is. And you can check that out. And yeah, we are going to be doing more of these webinars. We're just educational webinars. We've been doing some doctor interviews. We'll be doing some more of those. So I hope that you can all come back and join us whenever we do these. We love to have people watching, and we love to do this, right? We love to chat about this kind of stuff. So if you are needing a supportive doctor, like a lifestyle medicine doctor, maybe you're sick of medications, you're on a bunch of medications, and you really do need help with making that lifestyle change, find us at telehealth.love.life. We would be happy to help you. We have doctors who cover all 50 states, DC, and internationally. So no matter where you are, you can find one of us telehealth doctors at telehealth.love.life. And we hope to get to meet you soon. All right. Thanks, Dr. Pierce.
Thanks. Great being here.
Thanks, everyone.